I'm the creator of one of the most popular TOS treatment videos, as you can see by the views and comments. But I made this video over 2 years ago, and since then I have learned so much about Thoracic syndrome and everything related to it. And what made this last video popular and helped so many people treat their TOS in record time is the simple fact that we started off by actually releasing all of the tight tissues, creating that compression on your nerves and blood vessels in the first place. With the first muscle being the sternocleidomastoid, also known as the SCM. Now, your SCM doesn't directly create any kind of compression on your nerves and blood vessels, but it does set up the body for compression in other muscles that we're going to target in a little bit. So to get started, turn your head in the opposite direction for the muscle you want to massage. So for me, I'm going to want to massage my right SCM. So to do that, I'm going to rotate my head to the left side, which will make it pop out, and therefore I can grab it easily and begin working on it. Now, the first thing you want to do is simply look for the most tender spot that you can find within the muscle. And you can easily do this by just simply grabbing the muscle and pinching it and pulling it, making sure to go all the way down into the clavicle and all the way up towards the ear. And once you're able to find a tender area, make sure to perform now micro movements or a basic pulling. The idea of this is to simply grab the tissues and massage out that tender spot in order to release the tissues there. And by the way, I'll tell you all the time and how much you should be doing this at the end of the video. I just want to get through all the techniques and all the muscles first before we get into the actual structure of the program. And finally, once you're done rubbing out those tissues, you can then do a pin and stretch on the SCM by just simply grabbing the muscle and rotating your head in different directions or even tilting it, which is going to help strip the tissues as you hold on to it. Now, located right behind your SCM is going to be your scalene, which is the first major problem when it comes to thoracic outlet syndrome. You have 3 scalenes, with the anterior and medial being the main ones that can create compression due to chest breathing, stress, using your neck too much, basically just overuse, which is probably the most common issue for most of us. Now, in order to massage out these muscles, once again, we're going to start off by just looking for the most tender area within the muscles. You're basically looking for a nice little triangle behind the SCM, but in front of the traps. And there you'll be able to basically look for your little areas. That's how you know you're on the scalenes. Now, fair warning, there are some nerves and blood vessels that come out of this area, and you may run into them every now and then, which you will feel the difference between tender pain and nervy pain. Just don't feel like you have to press hard here. And if you hit a nerve, it's okay. Just move to the side and keep working on the actual tissues. Now, make sure you're not just pressing directly into the neck either. Just grab some tissues, slip it towards the back. So most of my pressure is towards the back now. And then from there, I'm just going to kind of rub it out. I can do that to the front, pull it back, and just try to rub it out there. The idea here is we just don't want to press directly into the neck. We want to grab some tissues and move in different directions before we do the techniques. And finally, we're going to do a pin and stretch here. Go ahead and tilt your head to that same side. Grab as much tissue as you can, starting from the top of the muscle, and then tilt your head to the opposite direction. You can even do a chin tuck or protrude your chin forward in order to try to manipulate and stretch out the different scalenes here between the anterior, medial, and posterior. Oh, and by the way, if you want a full-blown routine that you can just simply follow along with to not only do these massage techniques, but also the stretches, the mobility drills, and the exercises all in the correct order, then make sure to check out the link in the description below where you'll find my 28-day TOS challenge. All right, back to the content. Now, from here, we move down into the chest, into the Pec Minor, which is located underneath the Pec Major. Your Pec Minor is up in the top corner of your chest. And again, if this muscle gets tight, thanks to overuse, just constantly using your arms pretty much, then it can easily create compression on your nerves and blood vessels that run right behind it. Now, in order to massage out this muscle, start off with warming it up, looking for the most tender spots. Again, you're just kind of warming up the top portion of the chest. You can easily do the chest yourself, but the main focus here is the top portion. By hitting the top, you're going to also naturally hit the Pec Minor right underneath it. And once you're able to find a nice little tender spot, you can then do some pin and stretching here by just pinning it down and taking your arm through its full ranges of motion. If you don't want to get on the floor, I also recommend grabbing a yoga block and a ball and placing that up against the wall and then placing your pec minor into that area. So this way you can actually get away from the wall, but also get some pressure into it. And next up, we're going to be moving into the subclavius. This is a tiny little muscle located underneath your clavicle that also attaches to your first and second rib, which is how it can create compression on the nerves and blood vessels because they run between the clavicle and the ribs. So if this muscle gets tight, it pulls those joints together, those bones together, which then creates that compression. So you can easily find this muscle by just going underneath your clavicle near the sternum, near the center, and just looking again for the most tender spot here. You can also make it easier to access your clavicle by just reaching your arm forward and resting it on a table and then leaning back a bit, which will pull the clavicle away from the first and second rib. Now to massage out this muscle, go ahead and just begin performing some micro movements on it, going back and forth and side to side on it, on that most tender spot that you're able to find. And then from there, when you're done with that, go ahead and do a pin and stretch. Take that muscle, pin it down with your fingers or whatever tool you're using, and then take your shoulder and rotate it as much as you can, up, down, side to side, and rotations so that the clavicle is able to move with it. Now, there's one more muscle that you're probably missing here that I also missed in my old treatment video, and that is going to be the Corcoialis, a shoulder muscle located in the bicep. This is pretty much a tiny little muscle that helps the arm go up. So again, every time you're using your arm, this muscle is contracting and eventually will create compression on the nerves and blood vessels, therefore resulting in pain down into the fingies. So in order to work on this muscle, just work on the top bicep portion in order to get down into the Corcoialis. So you can either just start off by just massaging out the most tender spot that you can find by going back and forth and side to side using whatever tool you have available. And from here, if you want to do a nice little pin and stretch, this one is a little tricky to kind of feel it, but the idea here, if you want to start with a passive flexion with the arm in a forward position, you want to pin down that area, the top bicep muscle where that feels tender, and then we want to pull the arm back, which will stretch out that Corcoialis, that deep bicep muscle that's technically a shoulder muscle. Now from here, you can also jump into some basic stretches now. We're done with releasing the tissues, all the tight muscles, but that doesn't mean they're lengthened, and that doesn't mean there's still room for those nerves and blood vessels to go through. So in order to help that out, we need to make sure we're stretching out these muscles as well. We can do some basic stretches like a lateral neck stretch for the scalenes and the SCM. We can also stretch out the chest to not only stretch out the pec minor, but also the subclavius and even the Corcoialis a little bit. Once we're done stretching out the muscles, then we do our physical therapy exercises. You strengthen the rhomboids, you strengthen the lower traps, you do your deep cervical flexor exercises, your chin tucks. Because now that all the tissues are released and then they are lengthened out, your position, your posture, we'll call it, is better, which allows those exercises to be more effective and secure them for a longer period of time. I'm not going to get into the stretches or the exercises because I'm sure you've seen all of those already, but that just means we can now get into the guidelines for these massage techniques. So starting off, warming up the muscle. When you're looking for the most tender spot, that's considered warming it up, right? You want to do that for about 30 seconds. Not only are you searching for the most tender spot like we talked about, but you're also just helping getting blood flow in there, which will help ease the muscle and maybe even ease a little bit of the pain. After you're done warming up all the muscles and finding the tender spot, then those techniques you're doing, the micro movements, the pin and stretching, all of those are done for about 1 to 2 minutes each. And I do mean 1 to 2 minutes each. The idea is you should be massaging out each muscle for about 2.5 to 3 minutes each if you're in the beginner, maybe even 5 minutes if you're willing to put in the work. You can't just massage out a muscle for 5 seconds, 10 seconds and expect it to get results, just like how you can't expect to lift for 5 to 10 seconds or 5 to 10 reps, we'll call it, and expect to get big. The idea is you have to put in the time into all of these different muscles in order to actually release them. Now, with that said, if you're doing this, you're probably feeling a lot of tenderness, maybe even a little pain, and that is normal. Your muscles shouldn't be in pain anytime you press on them, right? Feel your arms, feel your legs. All those probably feel different, and then your chest, and then your neck, and then all these muscles that we just went over. That's not normal, and that's just a sign they need to be massaged out. Your goal when it comes to your pain tolerance, your pain level, is going to be at a uncomfortable position, but not so much that you're not able to breathe. So if you are tensing during these massages, then you are technically tensing, you're not breathing, and therefore you're squeezing the muscle, which is the opposite of what we want to do. It should be uncomfortable, maybe even a little painful, but you should be able to breathe through it, take big deep breaths through it so that the muscle can actually relax. And finally, it is normal to feel sore after doing this, especially if you've never done it before. Again, just think of it like going through an exercise that you haven't done in a while where you're going to feel sore for the next few days. Again, it's normal. This is a normal process, and it has to be done if you want to release these tissues. Now, if you want to take this up a notch and you have the extra time, then make sure to check out the video in the top corner where I'm going to show you the best exercises you can do for your TOS. They complement these massages really nicely, I promise.